Thank you, Chair. Honourable Ministers, distinguished ladies and gentlemen, on behalf of the Secretariat, I have the privilege to introduce document AFR/RC68/5 entitled Report on Regional Managerial Compliance Activities and Matters Arising Out of Internal and External Audits. The purpose of the document is to update the Regional Committee on the progress made in improving the managerial compliance of the region through the strengthening of the internal control environment, as well as to report on matters arising out of internal and external audits in the region. It goes beyond the traditional Regional Committee information document and provides an account of the last 3 years of work, including the background, actions taken, progress made, issues and challenges, and next steps. The African region in the past has been severely criticized by member states during global governance meetings on its poor performance in audit outcomes, overdue closure of audit recommendations, overdue DFC reports, and what was generally termed a culture of tolerance of non-compliance. To address these issues, an accountability and internal control strengthening initiative was launched around 5 key pillars: improved information sharing, clearly defined expectations and robust monitoring and evaluation, targeted training and direct country support, improved engagement with member states, and improved governance and oversight. The actions taken around these pillars are expanded on in the document and include the publication of a handbook on WHO business rules for ministries of health. Significant progress has been made in all the pillars of the initiative, with independently validated measures of success, which include no unsatisfactory audit reports in the region since 2016, while, as depicted in Annex 1, between 2012 and 2015, at least 50% of the audits conducted in the region were rated as unsatisfactory. The WHO Office of Internal Oversight Services, based on internal audits conducted in the African region, assessed that the overall effectiveness of internal controls had increased from 50% in August 2015 to 75% in April of 2017. A 54.7% decrease in the number of outstanding DFC reports between May 2017 and March 2018, resulting in a 44% reduction in the total amount outstanding over the same period. Closure of 5 audit reports between May 2017 and March 2018, and WHO's Independent Expert Oversight Advisory Committee reviewed progress of this initiative in 2016 and confirmed its positive impact on accountability, compliance, and control in the region. It also recommended that other regions explore the possibility of adapting this model to their own specific regional requirements. Despite the steady achievements, challenges have been identified that could negatively impact progress, such as outdated IT environment in terms of infrastructure, the need for more robust change management, a shrinking budget for management and administration while additional investments are needed, particularly at country level, and continued issues with member state compliance on DFC reporting as per Annex 4 of the document. In terms of the way forward, we will be enhancing our resource mobilization efforts along with introducing additional cost-saving and recovery measures. We will be increasing our efforts to reduce the number of recurring negative audit recommendations, as well as better utilizing business intelligence to prioritize interventions and target staff trainings. The Regional Committee is requested to take note of this report and endorse the actions proposed. I thank you, Chair.
Je crois qu'on a un problème avec l'interprétariat. Est-ce que les interprètes fonctionnent en français? Ah, ils ne sont pas là.
Oh, c'est pas possible.
Il faut trouver une solution pour ça. Est-ce que le secrétariat peut nous régler ce problème?
On n'a jamais vu un tel. J'ai dit, on n'a jamais eu un tel.
Est-ce que tous les interprètes sont là? Je vous remercie. Nous pouvons donc reprendre les travaux. Raoul, nous devons vous redonner la parole certainement.
Encore.
Thank you,
Naturellement.
Chair. So I guess I'm lucky I get to introduce twice.
J'ai la chance de pouvoir me représenter deux fois.
Ministers, distinguished ladies and gentlemen, on behalf of the Secretariat, I have the privilege to introduce document AFR/RC68/5 entitled Report on Regional Managerial Compliance Activities and Matters Arising Out of Internal and External Audits. The purpose of the document is to update the Regional Committee on progress made in improving the managerial compliance of the region through the strengthening of internal control environment, as well as to report on matters arising out of internal and external audits in the region. It goes beyond the traditional Regional Committee information document and provides an account of the last 3 years of work, including the background, actions taken, progress made, issues and challenges, and next steps. The African region in the past has been severely criticized by member states during global governance meetings on its poor performance in audit outcomes, overdue closure of audit recommendations, overdue DFC reports, and what was generally termed a culture of tolerance of non-compliance. To address these issues, an accountability and internal control strengthening initiative was launched around 5 key pillars: improved information sharing, clearly defined expectations and robust monitoring and evaluation, targeted training and direct country support, improved engagement with member states, and improved governance and oversight. The actions taken around these pillars are expanded on in the document and include the publication of a handbook on WHO business rules for ministries of health. Significant progress has been made in all the pillars of the initiative with independently validated measures of success, which include no unsatisfactory audit reports in the region since 2016, while, as depicted in Annex 1, between 2012 and 2015, at least 50% of audits conducted in the region were rated as unsatisfactory. The WHO Office of Internal Oversight Services, based on internal audits conducted in the African region, assessed that the overall effectiveness of internal controls had increased from 50% in August 2015 to 75% in April of 2017. A 54.7% decrease in the number of outstanding DFC reports between May 2017 and March 2018, resulting in a 44% reduction in the total dollar amount outstanding over the same period. Closure of 5 audit reports between May 2017 and March 2018, and WHO's Independent Expert Oversight Advisory Committee reviewed progress of the initiative in 2016 and confirmed its positive impact on accountability, compliance, and control in the region, and recommended that other regions explore the possibility of adapting this model to their own specific regional requirements. Despite the steady achievements, challenges have been identified that could negatively impact progress, such as outdated IT environment, the need for more robust change management, a shrinking budget for management and administration, while additional investments are badly needed, particularly at country level, and continue issues with member state compliance on DFC reporting as per Annex 4 of the document. In terms of the way forward, we will be enhancing our resource mobilization efforts along with introducing additional cost-saving and recovery measures. We will be increasing our efforts to reduce the number of recurring negative audit recommendations, as well as better usage of business intelligence to prioritize interventions and target staff training. The Regional Committee is requested to take note of this report and endorse the actions proposed. I thank you, Chair.
Je remercie.
Thank you. Do the distinguished delegates have any comments to make in response to this report which has been presented?
donnons la parole à la Tanzanie.
We give the floor to Tanzania.
Thank you, Mr. Chairman. Tanzania commends the WHO Regional Secretariat for the report detailing the work WHO has done on the regional managerial compliance activities and matters arising out of the internal and external audits, where the report has shown that the African region has a culture of tolerance for non-compliance with rules and policies to improve accountability, transparency, and risk management. We further take note and welcome with appreciation initiatives and actions aimed at strengthening accountability and internal controls already existing at the headquarters, region and country levels, targeting to ensure strategic, transparent, and effective overall approach to compliance and risk management. These have resulted into wealth of experiences and feedback generation from across the organization and beyond, with actions that have not only stemmed an improved engagement with member states, but also its clearly defined expectations, the robust monitoring and evaluation system. Mr. Chairperson, Tanzania as a member state has strengthened internal controls by ensuring rules and regulation of the management of funds are adhered to. All audit reports from internal as well as external audits of the year 2017-2018 has proved that a significant improvement in the accountability and compliance to rules and regulations with good internal control mechanisms and improved information have been shared. Lastly, while significant progress has been made, some countries will continue to face reporting challenges. Therefore, we join hands with other member states to urge WHO to continue working and supporting individual countries to overcome these challenges and implement required activities. Tanzania takes note of this report and endorses the proposed next steps. Thank you.
Je vous remercie.
Thank you. We will now give the floor to Côte d'Ivoire. Thank you, Chair. I am a new minister, newly appointed in Côte d'Ivoire, and I would like to respond to this issue on a matter of principle, because it's a matter of culture. And I would like to say that I particularly laud the approach taken to this point on audit, because it spotlights the responsibilities that we have as countries. This is important. Whatever we do, we've talked about means, provision of means and others, but I think the main challenge for us lies at the level of respecting policies and regulations. In other words, we need to ensure good governance, and it is important that within the framework of our partnerships, within the framework of our relationship with WHO and partners, we should bear in mind that the weak points or the weaknesses of our countries lie in poor governance. If we are not careful, we will keep wasting time and will not be able to attain the objective that we have set for ourselves. We have said here that, unfortunately, we do not have a culture of good governance. And that is the truth. And we have to take full responsibility for this. It is our responsibility to make sure that we correct our errors. If you have a bad student, you have to bring that student up to scratch. We cannot just keep complaining about lack of resources. That is what I would like to say at this point in our discussion. Thank you, Excellent Minister. We give the floor to Ethiopia.
Thank you, Chair. The Federal Democratic Republic of Ethiopia would like to comment on the Secretariat for the report on managerial compliance activities and matters arising out of the internal and external audits. The government of Ethiopia appreciates the efforts made by WHO in improving the overall compliance and risk management on issues arising out of external and internal audits so far. Similarly, the government of Ethiopia takes note on the challenges identified and proposed next steps and committed for its implementation as well. We would like to urge the member states to adopt the proposed action points in the report and support for the implementation. I thank you.
Je vous remercie.
Thank you. We have no more people who wish to take the floor. Does the Secretariat have something to add?
La Gambie.
We give the floor to the Gambia.
Thank you very much, Mr. Chair. I want to take this opportunity to congratulate the WHO for the report on the regional managerial compliance activities and matters arising out of internal and external audits, and to also recognize the efforts that are being done in terms of recommendations with regards to the findings or the challenges of the audit exercises, especially improving the engagement with member states by sharing the reports, and also improve governance and oversight. I think there is a lot of progress that is being done in the sense that if you look at it globally, most of our financial systems are very weak, very porous, or difficult to respond to the issues. And when I looked at the report, what I realized was that I said there is hope. We are all beginning to recognize the fact that these are some of the challenges, because it raises the issue of credibility from the donors, and also even within our own systems, and also encouraging a lot of acts that may not be in line with principles of financial accounting and procedures, particularly where resources are taking place. I would like to congratulate you for this report, and also for taking account of the fact that these are things that are there and is publicly acknowledged, and the need for responding to these challenges that are taking place. And for me, in the Gambia, we are emerging, as I said earlier, in a very difficult situation, and we want to embrace the best practices and to make sure that this democracy is going to respond to some of the issues of institutional capacity building, strengthening and creating the credibility that is needed to attract the right funds, and also to be able to be accountable to those that we are working with. And I think this is a lesson for all African governments to take note of, because we are aware of the spate of corruption, the poor institutional policies and culture within our institution in managing resources. Thank you very much.
Je vous remercie. Nous donnons la parole au Kenya.
Thank you. You should give the floor to Kenya.
Thank you, Mr. Chairman, and the Kenya delegation would like to thank the Secretariat for preparing this report, and we take note of all the contents therein. We remain committed to accountability and compliance with the set WHO financial rules and procedures, and we are in support of strengthening of the current system and the operationalization of stringent internal controls framework at all levels of the organization. And we do appreciate the continued support from the Secretariat to member states that have seen a remarkable reduction in overdue DFC reports between the period May 2017 and March 2018. Kenya, like a few other countries, have a unique governance structure consisting of two levels of government, that is at national and county level, and these governments are distinct and interdependent. And in order to enhance compliance, Kenya urges WHO to continue to support the National Ministry of Health to improve its capacity for oversight, to ensure that it has greater visibility and leverage in the disbursement, in the utilization, and also in the accounting for the DFCs that are disbursed to the county level. And this will ensure that there is joint ownership of the accountability process even when funds are utilized at the county level. And in addition, this process will facilitate the timely retiring of funds advanced as DFCs. We thank you, Mr. Chairman.
Nous vous remercions.
Thank you. We give the floor to Botswana.
Mr. Chairman, Botswana wishes to applaud the Secretariat on the comprehensive, well-crafted report on regional managerial compliance activities and matters arising out of internal and external audits. One cannot overemphasize the importance of internal controls in the governance structures and the effectiveness thereof. It is one thing to decry the limited resources that we have as a continent, and another to make sure that we safeguard the effectiveness of structures, with effectiveness of the same resources within our structures. Botswana therefore notes with contentment that efforts by the regional director to address persistent systemic weaknesses and ineffective controls across the organization, as previously expressed by the Independent Expert Oversight Advisory Committee, are beginning to bear fruit. This evidenced by, among others, the increase in the overall effectiveness of internal controls in the African region from 50% in August 2015 to 2017. We are particularly happy to note that the WHO country office in Botswana is listed among those that were successful in improving their performance in the areas of human resource and finance. For its part, Botswana commits to ensuring that direct financial cooperation reports are submitted within the stipulated time. Botswana notes the report presented and supports the recommendation contained thereof. I thank you, Mr. Chairman.
Thank you. Does the Secretariat have anything to add after these comments?
Thank you, Mr. Chairperson. And first, let me thank the member states for the comments and the appreciation for the work that we've done in the Secretariat, and to say that we will continue our support to countries. We have missions that go out to countries to review DFC activities, DFC assurance missions, and we have feedback with the Ministries of Health to provide them with information on where they can strengthen their controls and improve their accountability at the Ministry of Health level, and we will continue to do so. So just to thank the Member States, Chair.
Oui, Madame la Directrice Régionale.
Madame the Regional Director, please. Thank you, Chair. I would also like to thank the ministers and head of delegations for appreciating this report and for your encouragement, encouraging us to carry on along these lines. I have a few comments to make. First of all, we have revised the terms of reference of our program subcommittee. I think we did that 2 years ago. And it was a hope that during this regional committee we will have management experts who can take a look at this document. That is, in addition to the technical and program experts, we would also like to have people who are experts in finance, persons who are specialists in these areas which we have just discussed. We want to ensure that this committee is able to review the work that we do at the level of the region and to provide us with guidance such that we will not only listen to comments in general, we will also try to make a greater effort at the regional level to see how we can improve on this work.
I wanted to make, honorable ministers, that among the countries that are going to be newly joining the program subcommittee, we'd like to suggest that you nominate people who also are senior administrators, senior managers, so that we have a balance in the types of competencies that are in the committee, and we have people who have the expertise to look at this aspect of our work. As I said, in general, we have technical experts, public health experts, and this aspect of the work is not developing in the way that we would hope. In addition to that, I'd like to suggest, as we have tried in the past, that also some of the experts that are nominated to the committee, the Global Executive Committee in the PBAC, the Program Budget and Accountability Committee, should be management experts, because there's a group that looks at this work, and from our region we generally don't have people who have the right type of background to, in a way, reflect on the experiences, the challenges of the region, but also deepen the work that we do with you, with the program subcommittee on these aspects. We would really like to develop this further. So that's a request that I would make to countries that are about to nominate members to the program subcommittee, as well as to the executive board of WHO. Thank you very much.
Je vous remercie.
Thank you, Regional Director. Ladies and gentlemen, distinguished delegates, the Regional Committee notes, maybe we should note and adopt the measures proposed in this document entitled Report on Regional Managerial Compliance Activities and Matters Arising out of Internal and External Audits. It is so decided. So we have come to the end of our discussions of this item of the agenda. Does the Secretariat have any announcements to make?
Thank you, Chair. You are invited to participate during the lunch break to the side event meeting called Improving Public Finance Management to Advance Progress Towards UHC in Africa, HHA side meeting. This meeting will take place in side event room BC12. The side event room is BC12. During this side event, you will receive some refreshments to patient you for your lunch break. In the same room, those who will participate in this side event will receive in this room tickets for lunch. So once the side event is finished, you are still able to take your lunch rapidly before rejoining the amphitheater for the plenary session after lunch. The second point is that yesterday in this room there was a power bank found. So if anybody has lost a power bank, please contact the administration desk or the information desk and we will help you. Further, a participant is looking for a telephone that he lost in this room, and please contact the administration or information desk if you have any information. Thank you very much.
Je vous remercie.
Thank you. After that announcement, I think we are going to take our lunch break. So we stand adjourned and we will reconvene at 2:30 p.m. Thank you for your kind attention.
Dire que les gens pour le side event devront aller immédiatement.